COVID-19 is one virus within the coronavirus family, a collection of hundreds of viruses usually found in animals. Today, 7 coronaviruses infect humans, with 3 of them considered serious illnesses, those being the 2002 Severe Acute Respiratory Syndrome, also called SARS virus, the 2012 Middle East Respiratory Syndrome, also called MERS virus, and the 2019 SARS-CoV-2, better known as the virus that causes COVID-19. While the less serious coronaviruses can cause the common cold, these more serious viruses cause symptoms that are so severe that people can't breathe and need to be hospitalized. For most people, COVID-19 can be treated like any other bad cold. Rest, drinking fluids, and taking over-the-counter medication to manage symptoms like fever and congestion work well. For the people who develop much more serious symptoms and need to be hospitalized, treatment is primarily focused on supporting individuals while their body fights the infection and to reduce the patient's symptoms. Patients who have trouble breathing may be given supplemental oxygen. If the oxygen alone is insufficient to help the patient breathe, healthcare providers may choose to put patients on mechanical ventilation, such as BiPAP, and in some situations they may need to intubate and oxygenate the patient through conventional ventilators. There are evolving guidelines from the National Institute of Health on how to treat COVID-19. An individual's treatment heavily depends on their health condition and the resources available to the healthcare team. Remdesivir is an antiviral medication which disrupts a virus's ability to replicate and spread within the body. Remdesivir specifically is recommended for patients who have been hospitalized and require oxygen but are not on mechanical ventilation. Globally, remdesivir is in short supply, and many health institutions have very limited quantities of it. Dexamethasone is a corticosteroid, a drug that makes adjustments to how the immune system regulates itself. Dexamethasone, or other glucocorticoids similar to it, can be used in patients who need oxygen and can be used on patients who are on mechanical ventilation or not on mechanical ventilation. However, patients who do not need oxygen are not recommended to take dexamethasone as the side effects of the drug may worsen their condition. There have been a number of proposed treatment solutions you might have heard about in the news, too, such as the use of injecting the blood plasma of people who've recovered from COVID-19, also called convalescent plasma, into patients who are seriously ill with the disease. In September 2020, the National Institute of Health issued a statement that even with initial trials, there hasn't been enough evidence to show this treatment plan helps or harms patients, and they do not recommend using this treatment as part of routine treatment plans for the time being. In the spring of 2020, there was a lot of news coverage regarding the use of chloroquine and hydroxychloroquine to treat severe COVID-19 patients. In August of 2020, the National Institute of Health issued a statement that recommended against using these drugs, as initial trials in COVID-19 patients had either shown no benefit at all or had led to worse outcomes for patients due to the drug's inherently dangerous side effects. As a quick recap, COVID-19 is a virus that produces symptoms similar to the common cold. However, in some individuals, symptoms can be so severe they are life-threatening. For mild and moderate symptoms, patients can be treated with rest and over-the-counter medications. For severe symptoms, patients may need supplemental oxygen or mechanical ventilation. Guidelines for treatments are constantly evolving, and some treatments like remdesivir and dexamethasone may be beneficial in some patients. Other treatments, like chloroquine and hydroxychloroquine, are not recommended, as they have no clear benefits or may potentially harm patients.